And the last theme is strategic plan development. And when I say a strategic plan, I'm not talking about a 100-page leather-bound document that sits up on a shelf, gathers a lot of dust, and everybody bows to it when they walk into the boardroom. It's having a practical document, short, maybe 5 pages, maybe 10 pages, more bullet point, but it's really trying to identify, again, in the Wayne Gretzky model, where do we need to be in the future as a practice? What are some of the key success factors? So that we know what's the road that we need to travel to get to our destination. One of the things that I did with the practices that I worked with when I was doing the management, we started off with a strategic retreat. A half day, we got all the docs together on a Saturday to make sure we all understood, what is the vision of the practice? What are we trying to accomplish? What are the goals? What are the priorities? Who's going to be responsible? Who's accountable? What is the timeline? Because to keep it from just being a session where we talk about a lot of stuff and we complain about this, that, and all the challenges that we face, we're trying to generate a plan, we're trying to generate better outcomes so we know what do we really need to focus on for the best results. And again, I know that's very difficult for small practices where you have a lot going on, you're very busy, and creating that time where we could do that, or I could pull the staff together, or my partner, or a couple partners together. But I found it's very good, it's very helpful, because it gets back to that quote, if you don't know where you're going, any road will get you there. So it's something I think to think about, and at least start thinking about it from a planning standpoint. What are some of the things that we need to plan for? What are some of the opportunities that we can focus on to try to help position our practice to be successful in the future? So, when we do that, we talk about things like a SWOT analysis, which stands for strengths, weaknesses, opportunities, threats. Those are some of the things that we look at, and then we want to prioritize, for our weaknesses or for threats, what are the resources that we're going to need to bring to bear on that? What are potential partners, vendors, whomever it might be that we can work with? Working within PPN, how do we address these needs, these gaps that we have so that we can overcome them? At the same time, looking at it from a positive standpoint, what are the opportunities? Where do we have a potential advantage based on our specialty, our location, the network, the hospital, employers in the area? What are the potential opportunities that we can build on and really try to generate additional revenue and additional opportunities for the practice? One of the other key things that I think is very important, and it came up in a meeting we had this afternoon, it really depends on where you're at in your practice. So if I'm an older physician and I'm really looking, I'm only going to be here for 3 years and then I'm going to retire, or 3 or 4 years, the amount of time, effort, and cost that I'm willing to invest, to get out to that 3-year point, may not be as high. I'm really just looking to get to that 3-year or 4-year point when I retire. However, it may be pretty important if I have a younger partner, and it's certainly more important to the younger physicians. If I plan to be practicing for a while, these are things that I need to be thinking about. But it's also really important that the practice has succession planning, because what I've seen in practices that I work with, sometimes you have a managing partner who's really done a lot for the practice and helped it be successful in what it's done, and then that partner retires and everybody's looking at themselves and say, okay, now what? Because there's been no succession plan, there's been no mentoring and development of who's going to be the next physician to help manage the practice or lead the practice to become successful. And if there's not anybody within the practice, again, do we have an infrastructure? Can we go to PPN? Can they provide some of the leadership, or are there other physicians that can help us be successful to fill that gap? Planning for growth, so as we have the growth with the Affordable Care Act, 30 million new patients coming in, payer mix changes, a lot of them are going to be Medicaid, the state exchanges, we have the aging baby boomers, so around 10,000 patients, or 10,000 people are retiring, going on to Medicare, people living longer. So there's more medical services being provided, there's going to be growth. How is our practice going to accommodate that? That's an important concept that you want to keep in mind in your strategic planning or your strategic thinking. If we go back to a couple of the prior slides where we were talking about making the practice more efficient, if I see on average 40 patients a day, and I can make the practice more efficient so we can see 4 more patients a day, those 4 patients' revenue goes right to the bottom line. So if I can increase efficiency, I can see more patients, and I can also help the practice become more profitable. So that's another alternative to look to accommodate growth. Redesigning clinical processes. So it's all about maximizing the physician productivity. The model that I like to use, I think dentists get it. The dentists that I've visited, typically when I go in for my routine visit, I see the dental hygienist, and she pokes and probes on my teeth and cleans them and gives me fluoride and takes x-rays if they're needed or not. The dentist comes in for somewhere between 30 and 45 seconds, pokes and probes a few times, looks at my gums, says, we'll see you in 6 or 9 months, unless I've got a cavity. He's spending, or she's spending, all of her time doing high-value procedures, filling cavities, doing bridge work, doing the procedures, and other staff that can do the lower cost service, the cleaning and so forth, are doing that. Ideally, that's what you're doing in your practice. The physician is seeing new patients. New patients are the lifeblood of the practice. They typically are the ones, new patient services pay more than established patient services. The new patients are the ones who typically have more complex problems, have procedures done, and ideally become established patients. So you want to have that good relationship development. So I want my physicians, as much as possible, seeing new patients, and maybe it's a PA or an NP, sees, some of the established patient visits, so I can spend more time on new patients, or I can spend more time doing procedures or medical decision making. But those are some of the things that you want to think about. How can I spend the maximum amount of my time on the highest value services that are the best revenue producing, the best value producing? Recruiting needs, so prediction of shortages of physicians in the future. A lot of this is specialty specific. A lot of physicians coming out of residency now are much more lifestyle oriented. They're more interested in, they're coming out with a lot of debt. I've seen studies, $200,000 of debt is not at all uncommon of residents now when they graduate. So the mindset of some of the new physicians is different than of prior generations. So being able to recruit them into an independent practice and being part of the business could be challenging. How are you going to address that? How are you going to fit the physician needs? Is it with using PAs and NPs and other care providers and so forth? But those are some of the things that you want to start thinking about. If we've got all these patient services that we're going to have to accommodate in the future, how are we going to provide the resources within the practice to accommodate them? The last bullet point I've always found to be very interesting, and that is, according to the Medical Group Management Association, better performers actually have higher staffing ratios, higher staffing expenses. And the reason is because it gets to that point that I was just saying. The most productive physicians have support staff that allows them to be more productive. Those same physicians generate higher average revenue per FTE physician than the non-better performing practices. And it's because their staff help them be more productive and helps them to focus on the highest value activities, procedures, and so forth. So as you're looking to become more productive, you may in fact look at, is there a staff person, at a reasonable wage that if I would hire that person, that would help me become more productive, spend more time doing procedures, spend more time seeing new patients, whatever it might be. But it's not necessarily that I want to cut my staff and cut my expenses. I may in fact benefit by having the right staff and having more staff that enables me to be more productive and generate more value. So, in summary, how do we plan for healthcare success? What I hope I've shared, and like I said, I know I've thrown a lot of information out at you, it's overwhelming in some sense, but my hope is that you've gotten a general flavor about what are some of the key strategies we need to be mindful of. The old adage is luck is when preparation meets opportunity. My hope is I've done the start of giving you some preparation so that when opportunity comes, you'll be able to see it, you'll be able to start planning. And so the first point is really starting to identify, for my practice to be successful 3 and 5 years in the future, where do I need to be? Where does the practice need to be? What are some of these themes that I've talked about tonight that I need to start thinking about? Is there some low-hanging fruit that we can start with, ideas that I can apply to my practice? How can I create value, for the patient, payer, for the system? What are the information technology, expertise, resource gaps that I have when I look out in the future? And how can I address those, either with partners, vendors, the hospital, the PPN, but really looking at, what are the options that I have? I'm not here alone. I have opportunities. how can I engage those options and resources to help me be successful in the future? And then really look at, what's my specialty in my particular situation, and what are the opportunities that I can use to hopefully, leverage it and be successful in the future.